Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today we are looking at the autopsy and we are discussing the types of incision. So to begin with, first is the eye-shaped incision. So this eye-shaped incision is very simple and it is convenient. That is the main advantage. It is a very simple procedure. And what is the indication? It is used routinely in practice, and procedure is it extends from the symphysis menti to the symphysis pubis. So it's from the symphysis menti to the symphysis pubis, and it takes a curve towards the left of and around the umbilicus. Next we will look at the Y-shaped incision. Y-shaped incision. So this Y-shaped incision is it prevents cutting of the chest skin in the midline. So this is one of the major advantages. It prevents the cutting of the chest skin in the midline. So indication is the Y-shaped incision is mainly preferred in case of the females. And the procedure. So it commences at the anterior axillary fold on the chest on either side and runs downwards anteriorly beneath the breast as to meet the xiphisternum, and then it runs downwards in the shape of eye-shaped. So eye-shaped incision. So where does it start? It starts at the anterior axillary fold and it runs on the chest on either side and runs downwards anteriorly beneath the breast, and it meets the xiphisternum and runs downwards in the shape of eye. So it runs downward as the eye-shaped. Next is we move on to the modified Y-shaped. So this is the modified Y. So modified Y it has a better exposure and allows the study of the neck structures. What is the speciality? The neck structures is mainly seen with this, and it is preferred when a detailed study of the neck and the structures are required, such as the asphyxial death due to the neck compression. And how does it begin? The modified Y, it begins at the angle of the mandible, whereas the Y-shaped, it begins at the anterior axillary fold. This was at the angle of mandible. So this is at the angle of mandible and on either side, and is brought forward downwards and to meet the suprasternal notch and then runs downward in the shape of eye. So both of them, it runs as an eye-shaped incision downwards. Next is we move on to the elongated X-shaped incision. This is the elongated X. So the elongated X-shaped incision, it is helpful for the reconstruction of the events prior to the death. So it helps in reconstruction, this is very important, reconstruction of events from death. And next is, what are the other features? Then comes the other important point being, it should be practiced in case of the custodial death. So in case of custodial death, it is used, and it is used. How does it begin? It is used to dissect out the subcutaneous structures in the back and identify and evaluate the extent of the blunt injuries. So it is used to dissect out the subcutaneous structures. Structures are what is removed. Next is, so these are the main incisions. One was the I-shaped, Y-shaped, modified Y-shape, and then we saw the elongated X-shape. To learn and grow daily like this, please do subscribe.